Hello, my name is D.Jones, and I'm a nursing student at the University of South Alabama. And today I will be doing my injection site checkoff. You can scan the room. Okay, so the first injection site we're going to go over is the deltoid. We would start at the chromium process, and the way I can identify this is if I lift his arm up, I would have seen an indentation right here. So we're going to go 3 fingers down from the chromium process, and I'm going to make a V shape like this. And in this area here is where we give an intramuscular injection, and that'll be at a 90-degree angle, and we would use a very small needle. Next, we will do the dorsolateral injection, and that will usually be on the back of the arm. So you would go 3 fingers down from the deltoid injection and 3 fingers above the elbow. And in this little rectangular space, you would give a subcutaneous injection, which would be at a 45 or 90-degree angle. It depends on the size of the needle and the length and how much subcutaneous tissue that the patient has. Okay, now we're gonna do the abdomen. Okay. I would find the umbilical, which would be right here, and we would go 2 inches out from it, and then I'll make sure I don't pass the coastal margin area or below the pubis, and then I'll make sure I don't pass the superior and anterior iliac spine, and that'll leave this U-shaped area right here, and this will be subcutaneous injection at a 45-degree angle. And the reason we do that is for patients that need repeated subcutaneous injections. So now we will move on to the ventrogluteal. First, I would identify his greater trochanter, and it'll be right here. I'm gonna make sure my thumb is towards his groin, my index finger is towards his superior anterior iliac spine, and my middle finger and my ring finger is toward his iliac crest. I'm gonna palpate for good muscle. This would be good muscle, and this would be an intramuscular injection site at 90 degrees. Now, lastly, I will be doing his vastus lateralis. I'm gonna find his greater trochanter. I would go a hand spread down from it. Then I'm gonna find his knee, and I'm gonna go a hand spread above his knee. Then I'll make sure I don't pass the midline of his upper thigh or the midline of the side of his thigh, and it'll leave a triangular space here. And I will put an intramuscular or a subcutaneous injection site in 1/3 of the middle of this area, and I am done with my injection site video.